What's up, guys? This is Michael Coe from Movement IQ Physical Therapy for the BJJ Body Restoration Project. So what I wanted to show you guys is a small little tweak I like to do for posterior hip flexibility. So I already showed in a different video a way to do hip flexibility, which is going to this S-mount sit stretch position and then leaning forward, and I'm targeting the right hip in this instance. So here's another way you've probably seen people do. It's oftentimes called a glute stretch or a piriformis stretch. They're kind of interchangeable. It looks like this. So the stretch goes, or you get in this figure 4 position here, and then you bring the whole leg up towards you. Alright? So this looks very similar to the triangle choke. So if you want better flexibility with a triangle choke, or for your ability for your leg to come up against someone's back as you're trying to transition to, let's say, an omoplata. Alright, having that hip flexibility is going to be very important to be able to get your foot in the right position to hold that opponent in the position you want them to, and to control them. So what I'm looking at is, well, what's going to limit this motion here? You're going to have this rotation through here. How low can this hip come up? The issue is that the body likes to go into positions of least resistance. So the path of least resistance for that motion is going to be the knee's going to come up and out away here in this direction here. What happens is the hip joint capsule opens up a lot more, has better flexibility. But I don't want you to only have to depend on the knee coming out to here. I want your knee to come inwards more and have the ability to then rotate in the proper position. So I'm going to switch around and show you the small tweak that you need to do for the stretch. So if I go here, if you do the stretch, there's a good chance that you're going to have this foot on the foot on the knee, but just having more of the foot on the knee instead of the ankle, and this knee's going to come out and you're going to be at this angle. And then you're going to come up. So instead of that, what I want you to do is concentrate on having this thigh be a 90-degree perpendicular angle to your pelvis. Instead of coming out to here, I want that femur to go straight up. So now what I want to do is make sure that this this foot is not so much the ankle, but then the bottom part of this bone here, your tibia and fibula. So if that part is on the knee there, and as long as you can, that's going to help you be able to align this hip up. Which happens for a lot of you is that if you have hip tightness, this will really tighten up the hip a lot faster. So if you can get to this point here and then pull up, what you do is you're automatically tightening up the hip capsule joint so that the stretch is going to be much more effective. You're not going to go as far as you can see more of your deviations and limitations within that hip. So I like to have people hold for roughly 30 seconds to a minute for all the stretches. Do them repeatedly through the day over time. Alright, guys? You guys have any more questions, please comment when you have a chance. If you have any friends that also do Brazilian Jiu-Jitsu and want to have this resource available to them to be able to help their bodies, please invite them when you have a chance. Thanks, guys.